Oh, I did.
So, welcome everybody. Thank you so much for joining us, whether you're tuning in live or watching the replay. So I'm Emma Cooksey. I am Project Sleep Apnea Program Manager, and I'm the host for today. We're going to be talking about mouth taping and sleep apnea as part of our Sleep Apnea Squad program. So I just want to, we're going to do proper bios, introductions in a little bit, but I want to just kind of go around and let all of our panelists just say their name and where they are, just to say hi. Do you want to go first, Ronnie?
Sure. I'm Ronni Fuchs. I am coming to you from Brooklyn, New York.
And Kaitlyn?
I'm Kaitlyn Shrum, and I am in Jacksonville, Florida.
And I'm Dr. Chawla, and I'm from Chicago, Illinois.
Love it. And so for any of you that doesn't remember, I'm in St. Augustine, Florida. So me and Kaitlyn are extremely close. So I'm just going to go ahead and share my screen here. And let's just do this. Can everybody see this okay?
Yep.
Yeah.
Okay, awesome. So we're just going to go over a little bit of housekeeping before we get into our discussion. So, as you're joining, if you're joining us live on YouTube, go ahead and share your town, your state, and country if you're outside of the US. And we love to see where people tune in from. And the more you like, comment, and share this video, the more people can find the content. So, we love that. One thing to note is videos and comments are always public. So if you're going to share anything, especially about your own health, make sure you don't share anything you don't want to be public because those comments will stay with this video after today. Definitely send us your questions in the comments. If you have particular questions for all of us or for one particular panelist, you can do that, and we'll try and answer as many questions as we have. Then also good to note that nothing we're doing today is medical advice. So everything today and everything Project Sleep does is for educational purposes only. So we want to share some good information, but if anything we're talking about raises questions or concerns in your own mind about your own health, you're going to want to take those questions to your own doctor. And then the last thing is we're building a toolkit together. So every time we do one of these YouTube lives, we want to meet people where they are. So we have this video that stays on YouTube. We create a podcast from the same recording. And we also work on a toolkit, which then can be downloaded as a PDF on our website. So this is like just a few pages from our most recent one, which was fighting sleep apnea, shame, and stigma, which was earlier in the year. But I had a bunch printed because I was at the Carolina Sleep Society. So I just kind of wanted to show you guys, like they're quite hefty. They're like 15 odd pages long and like we put a lot of effort into them. So yeah, if you haven't found those yet, go to the Sleep Apnea Squad page and you can download them and print them. It's completely free and just share them as far as wide and wide as you can. So on to our special guest today. So Ronni Fuchs is a native New Yorker who has lived her entire life in Brooklyn, New York. She's married and has two children, Emma, who is 28 and works as an admissions coordinator at a private preschool in Tribeca, and Eric, who is 31 and works as a company manager on Broadway. Ronni and her husband are retired and enjoy the freedom of doing what they want when they want. So I'm going to leave the rest of what Ronni had here because she's going to tell her story in her own words in a second. So on to Kaitlyn. So Kaitlyn Shrum holds a certificate of clinical competence from the American Speech Language and Hearing Association, is a certified myofunctional therapist, a qualified orofacial myologist, and a certified Buteyko breathing method instructor. And if you're not sure what all of those things mean, she's going to explain what those things mean in a minute. Kaitlyn's also the author of Frankie Goes to Camp, a children's book on breathwork techniques, and she's been published in several professional journals for her research on pediatric sleep disordered breathing, among other topics. Additionally, Kaitlyn is a board member of the Oral Motor Institute and provides mentorship and continuing education to other speech and language pathologists, occupational therapists, and registered dental hygienists. Welcome, Kaitlyn.
Thank you.
Dr. Upneet Chawla, MD, is a double board certified physician in internal medicine and sleep medicine. She serves as an assistant professor at Rush University Medical Center with roles in both departments of internal medicine and sleep medicine. Dr. Chawla completed her residency in internal medicine at Mercy St. Vincent Medical Center in Ohio and her fellowship in sleep medicine at Rush University Medical Center. Before her clinical or beyond her clinical and academic roles, Dr. Chawla aims to simplify the complexities of sleep medicine for the general public. Through her presence on social media platforms like Instagram and TikTok, she's Sleeping Beauty MD. She provides valuable insights, tips, and behind the scenes look into the life of a sleep medicine expert. So welcome, Dr. Chawla. It's so nice to see you.
Thank you.
Okay, so let's just really quickly give an overview of what we're talking about today. So we're actually not going to go in this order because I wanted to start with Ronnie's story. But we're going to talk a bit about mouth taping. It seems to be such a craze across all of social media right now. We wanted to kind of talk about where that came from in the beginning. And the reason we have a whole hour to talk about this is that it's not a really simple topic. So I think sometimes it would be really easy to say it's never okay to tape your mouth or everyone should do it. But really the truth is a lot more nuanced than that. So we have a little bit of time to dig into it. Also, we're going to talk specifically about people with obstructive sleep apnea and ask whether mouth taping is safe for people with obstructive sleep apnea and what kind of questions you might want to ask before you start taping your mouth. And so the last point here is what we're actually going to start with. So we're going to talk a little bit about mouth taping with CPAP because I know Ronnie has an experience with that might be helpful to people listening. So without further ado, I'm going to hand off to Ronnie to share with us a bit about her journey. So do you want to just start with a little bit about your journey to diagnosis maybe and what kind of symptoms you had, how you got that diagnosis, and then a little bit about, how you even came across this idea of mouth taping?
Sure. So I've been using a CPAP now since March, but I probably should have been using one 4 or 5, 10, 15 years ago. I'm a snorer, so I've been told. My daughter has told me that she would not share a room with me in a hotel anymore because of that. My dentist, who is someone that does a lot of sleep apnea work in a local hospital, had been suggesting that I get a sleep study. And I was like, yeah, sure. Okay, right. I'll do that. And then I happened to go to an ENT for related to my ear, and I passed with flying colors. And just in the course of conversation, I can't even remember how it came up. She started to ask me questions. She asked me if I snored, if I woke myself up when I snored, um, if I had headaches, if I had dry mouth, if I had any kind of anxiety. I answered yes, all of the above, and suggested this was back last August and suggested that I consider doing a sleep study. So I procrastinated and I finally did it in January of this year. And I probably got the results about 4 weeks after I did the study. And as I was saying before we came on, I was shocked because it came back as severe. So then I waited for, to start picking up my machine and getting a mask. And like many people, I struggled to find the right mask and discovered at that time, snoring, mouth breathing. The best mask for me would have been either a hybrid or a full mask. And I have a hybrid, but I really don't like the feeling of having my mouth fully covered. And like everything else in this world now, you can find help on social media, and there are a couple of Facebook groups for sleep apnea. And I was on one where they were talking about mouth tape. And I tried a couple, I was doing this, like the strips on my nose to see if that opened my nose up more. And then I forget why I decided I'm just going to take a risk and get mouth tape. And I started with one and I was using it and I was finding that my, um, I still felt like I needed it. I switched to a different one that had an opening and it felt less confining. And then I don't know, I guess now it's probably about 8 weeks ago, I thought I'm going to try not using mouth tape. And I obviously trained myself to be a nose breather and not a mouth breather. Although I find at times now I still have to use the tape, but not regularly. But I know it was very controversial. There are a couple of people on the pages that are like, no, don't do it, don't do it. But it allows me to, I use nasal pillows and I'm so much more comfortable with that. I will, again, if necessary, like if I feel like I'm just too tired to pay attention to nose breathing when I fall asleep, I'll use the mouth tape. But I think I was using it every night probably for about 3 months. And now I just use it when I need to.
That's great. So I think one of the things that people don't realize is that mouth tape for some people, um, with CPAP users who are using a nasal mask, it's really important to keep your mouth closed because your mouth falling open can really mess up the pressure, right? If the air is going into your nose and out of your mouth, that's not ideal. So always, like historically, people would be offered a chin strap that would keep their chin like lifted up and their mouth closed. And so I think among in the sort of CPAP user community, especially on Facebook groups like you were talking about, mouth tape I think has been talked about as an alternative to if you don't want to use the the full chin strap kind of thing.
So what
And
I want to say about the chin strap is I can't use it. I have a recessed jaw. So the only thing that works for me if I want to use a chin strap is I use like an old-fashioned headband. But even that, still slips up. So
yeah,
because I have a recessed jawline, it was sort of like I had no other option. Like I know people, everyone's saying, "Oh, I tried 3 or 4 different chin straps." And I'm like, I am giving Amazon and PAP MD and all of those other companies a lot of money and they're going in the garbage. So let me try this controversial thing and see what happens.
yeah. Well, thank you so much for sharing all of that. It's super helpful to get us started. So I'm just checking in. I wanted to say a really big thank you to my colleague Lauren, who is watching the chat for us. So it sounds like we've got people tuning in from all over the place. So from Calgary, Virginia, Wisconsin, Chicago, Tennessee, Boston, Nashville, Florida, Los Angeles, and Long Island, and Oregon. So hi everyone tuning
Wow.
in. It's always kind of fun to see where people are tuning in from. So I guess we wanted to go all the way back to the beginning. And maybe Kaitlyn, if you could just kind of start with this idea. I think a lot of people tuning in might be thinking that there's really no difference between, nasal breathing and mouth breathing. So I think like there's this kind of thought that the air is kind of getting to the same place. So why would it matter if you're breathing through your nose or your mouth? But actually, they're quite different. So I'm hoping you can start us off by kind of explaining that difference, and then also maybe talk to us a little bit about what myofunctional therapy is.
Yeah. Okay. So nasal breathing and mouth breathing, very different. They will eventually get you the same end result is that you're getting oxygen. However, nasal breathing is the way our body was meant to breathe. So this is a backup. This is not how we're supposed to breathe. There are there are certain instances which we can chat about when you mouth breathing is okay, but for the most part, you want to be nasally breathing because it's an air filter. So first of all, you imagine the difference between like think about what comes out of your nose when you blow it. And then imagine that not getting filtered as it goes through your mouth. That's like how I like to describe it, especially to my younger clients, because then they're like, oh, that's disgusting. So your nose is a natural filter. It's warming the air, so it's not cold air going down and hitting your lungs. Um, it humidifies it, and then also it improves our uptake of oxygen. And that's really, to me, that's one of the biggest ones. It's mouth breathing is less efficient. So when we're mouth breathing, you're typically taking shallower breaths more frequently, and it tends to be more upper chest as opposed to those fuller diaphragmatic breaths. Um, and when you have this rapid, shallow pattern, it expels too much CO2. And so we're gonna have a quick crash course in chemistry. And please stay with me. If you have questions, please put them in the chat. We always think of CO2 as a waste gas, but it's not. CO2 is actually helping drive your respiration and is helping you absorb oxygen. If you are breathing rapidly, you're expelling too much CO2. And the effect that has on your blood pH is that it makes you too alkaline. So our bodies are pretty exact where we need to be for our pH levels. We want to make sure that we're not going into anything. We want to stay 7.35 to 7.45. That's our comfort zone. When we're expelling that oxygen, when we expel that CO2 too rapidly, what happens is the oxygen binds to hemoglobin and it doesn't get released to our blood vessels. So you're not absorbing it. You're not using it efficiently. So that's kind of like the long story short of it, without going too deep down a rabbit hole into blood pH.
Yeah, that's really
But
helpful.
yeah. And the other thing too, and this is important to remember, is that when you're taking deeper diaphragmatic breaths, the lower lobes of your lungs are much better at absorbing oxygen, because those little tiny, if you look at a picture, they're going to look like little tiny bubbles or like little leaves on a tree. Those are alveoli. You're much denser in your lower lobes than you are in your upper lobes. So if you can bring that oxygen to the lower lobes, it's going to be absorbed better. So that's kind of the quick and dirty version of why we want to nasal breathe.
I love that. And so where this whole mouth taping thing began is even as a concept. So maybe you can just explain to us a little bit about, so I think that really like this, it's not maybe the first time anyone had taped their mouth, but I think when it really hit the um our culture as a phenomenon was really when James Nestor had his book Breath, which was a bestseller. And so I've interviewed James Nestor from my podcast, Sleep Apnea Stories, and I know that Kaitlyn's been all on retreats with him and everything. So James Nestor did a sort of experiment, but even he would say it's not like, research standard experiment, but himself and another friend blocked their noses. So they're both perfectly healthy with no snoring and sleep apnea events. And they blocked their noses and did, I think, 15 days or something. And they charted, like, they did exercise, they slept like that, they did all of this. And they showed over that time that they had given themselves snoring and some apnea events. Now, again, they didn't have full polysomnograms and it wasn't like a full research study, but it was just interesting enough for him to really delve into this idea of nasal breathing versus mouth breathing. And so when James Nestor talked about mouth taping, he's talking about a tiny postage stamp size piece of 3M micropore tape that he would just put like on his lips to kind of encourage his lips to stay closed, but he could like open his mouth like easily and it would, move. But I think that we've kind of like with mouth taping moved to this whole like you can buy mouth tape that like there's no vents in it and it looks like this huge amount of tape. So Kaitlyn, do you want to just kind of like talk a little bit about like was that just about accurate that that's where this mouth taping idea came from?
I tend to think it like started with breath. And I have to say, I love that book for certain reasons. I think it was a really great way for people not in the field to get exposed to the importance of nasal breathing and the overall health impact it has on our daily lives. I think it's great for that. And I recommend it to a lot of my clients for homework. I think that there is nuance that, obviously he can't go into everything. And with breathing in the human body, we're all different and there is nuance. But yes, I would say that that kind of like introduced it to the mainstream, and then social media, just as it does, grabbed onto it and took off running. And now we have like, I mean, there's so many different things. There's the mouth tape. There's the Kardashians now have like a full on like face firming like chin strap that you can wear to keep your mouth closed. So it's a lot. And I do have to say, when I went on James Nestor's retreat, they did hand out mouth tape. It was just like a thin, our goodie bags had mouth tape, and myself and the other SLPs who are also specializing in Maya, we kind of all were like, oh, there's probably a good amount of people here who shouldn't be just
Yeah.
blindly taping their mouth shut.
So you just mentioned, so being a speech and language pathologist and a myofunctional therapist, I think a lot of people tuning in won't really know what a myofunctional therapist does. Can you maybe explain to us a little bit about what that part of your job is about, and just generally like a bit more about, like, it's not just about taping your mouth, right? Talk maybe a little bit more about like the ideal, like how people should be in resting posture, and you know what I'm talking about.
Yeah. Yeah. So the way I like to explain myofunctional therapy, it's kind of like physical therapy that just focuses on strengthening the airway and the musculature of the face and the neck and the throat, the oral pharynx. That's the best way to do it, because we do neuromuscular rehabilitation. So best way to describe that is we're doing new muscle memory so that you are resting your tongue in the correct posture. And so for people who aren't aware of where your tongue's supposed to be living, it should be right up, lightly suctioned to your palate or the roof of your mouth. Shouldn't be pushing on teeth. We want it just lightly up there. That keeps it up out of your airway. It also provides the scaffolding for correct facial development, which I think we're going to go into later. We want it to live up there. We want our lips to be closed without any strain at rest. We want to be nasally breathing, and we want to have the correct swallow pattern. So the correct swallow pattern, again, not something that anyone ever teaches you when you're growing up, but the correct swallow pattern is that your tongue tip is going to push up onto that kind of bony ridge right behind your teeth, and it's going to move backwards in a wave-like motion for you to correctly swallow. And again, no one tells you this. It's supposed to happen like that, but for so many of us, that's not the progression of how we develop, because there are environmental factors and genetic factors that get in the way. But the goal of myofunctional therapy, again, we're going to have nasal breathing, correct tongue posture, correct lip posture, and the correct swallow. So that's what we focus on. And the way I kind of got into that is I specialized in feeding before I got into myofunctional therapy. And then I had randomly heard about myofunctional therapy through a different therapist. And I was like, okay, that sounds interesting. And then when you actually learn more about it, you're like, okay, so this is all airway based, which makes so much sense if you were working with feeding and speech and all the structures that are overlaid over your airway.
Well,
So that's
thank
how
you
I
so
got
much
into it.
for, I just asked you like 7 questions. You did
That's
really
okay. I probably forgot which ones you asked. So if I missed one, please ask
No, that
again.
was great. So the next thing I wanted to get into, Dr. Chawla, I wondered if you could just speak a little bit about this idea of, it seems like, especially on social media, you have a lot of, sleep hacks or snoring hacks. And then at the other end of the spectrum, you have people going to a doctor like you who specializes in sleep. And so I kind of just wondered if you could share with us a little bit about what people you think need to know, like before they start just randomly taping their mouth. Like, what are the sort of signs and symptoms that warrant actually going to see a medical professional for screening first before they do that?
Yes, totally. And first and foremost, thank you so much for having me because I do think this is like a very important topic for everyone. We all need sleep, right? So I think that when we talk about sleep issues, the main thing that comes up is sleep apnea, which, yes, it is a very commonly underdiagnosed problem. So when people think of sleep apnea, they start thinking, like, okay, well, I don't wake up, choking or coughing at night. I don't snore. Yes, most people who have sleep apnea do have those symptoms, but just because you don't have those symptoms doesn't mean you don't have sleep apnea. Um, and just to kind of rewind just a little, we should probably explain what sleep apnea is.
Yeah, that would be great.
So, for anyone who doesn't know what sleep apnea is, it is a condition of your upper airway where it closes at night, causing pauses of breathing during your sleep, which prevent you from falling into that deep, restful sleep. And so, oftentimes, people who have sleep apnea will also feel very sleepy throughout the day, can't get through the day without a nap. But in my opinion, I think if you have any issue with sleep, if you're waking up a lot at night, if you're having trouble getting up in the morning, if you're including snoring and waking up, choking or gasping for air, I think any little issue with sleep, get a sleep study done because the risks of untreated sleep apnea far outweigh, the inconvenience of getting a sleep study done. And these days they have home sleep studies, so it's not even that inconvenient anymore. So to answer your question about who should go see, a sleep doctor, I would say if you have any issue with sleep whatsoever, just get it checked out. The worst that can happen is you go, you get a sleep study done, and they say you're good. But treating it just like how Ronni had, mentioned before, she didn't even realize how severe it was, and has seen an improvement. So I would say any issue in sleep, get it checked out.
Yeah, that's great. I also wonder about is there a particular reason like somebody should go to an ear, nose, and throat doctor versus a sleep specialist? Like maybe people, I'm just thinking of people who maybe they don't necessarily notice a lot of issues with their sleep or daytime sleepiness or anything, but they do notice that they have trouble breathing effortlessly through their nose. So I'm kind of thinking those people maybe an ear, nose, and throat.
Yeah,
Like, good idea.
great question. There's a lot of overlap between ear, nose, throat, and sleep, right? Because that's how we're breathing through our nose
Yeah.
and throat. Generally, ear, nose, throat, they're surgeons. So a lot of times the solution will be some sort of surgery. So if you have more of like a daytime kind of breathing problem, I would agree with you that probably the best thing to do is see an ear, nose, and throat doctor where they can kind of take a little camera and look into your airways. And oftentimes they will also ask sleep questions because having those kind of daytime problems can often also occur at night without you realizing. So I agree with you. If you're having some sort of daytime breathing, maybe ENT is the first way to go. And I'm sure they will do a thorough evaluation and send you to sleep if they think that's also necessary.
So that's kind of how you went about it, right, Ronnie? Like I feel like you said it was an ear, nose, and throat
Yeah.
doctor.
So when I was having the conversation with my dentist, my plan was to go to a pulmonologist. And it was sort of just serendipitous that I was sitting in the ENT's office having, a hearing test and some other stuff when the conversation happened. So I did do a home sleep study, which is what made me more likely to go ahead and do it, because the idea that I could do it in my home, in my bed, not having, a nurse come in and out during the course of the night was much more, for lack of a better word, attractive to me.
Right.
And that's why I did it at home. And I know that, a lot of people said you don't get as how much, how much more severe could my severe apnea be if I had done it in a lab? It wasn't going to come out mild. So I was glad that I did it that way.
Yeah, that's great. Yeah, we might want to just, Dr. Chawla, do you want to just explain that to people a little bit more? That I think sometimes people think that the only way to test for sleep apnea is to go to a like in-person lab and sleep, like I think oftentimes that's not the case now.
Yeah, yes. These days they have home sleep tests where the equipment can vary. Ronnie, I'm not sure what kind you had, but it can be as simple as just a watch that you wear to bed, a one night thing that can collect data. I will say that there are oftentimes it can underestimate the severity, but like you mentioned, severe sleep apnea is severe sleep apnea, and you're going to treat it the same. The only issue is when it comes back negative, but we are still suspicious that there is sleep apnea. And at that time, if we decide we need to do an in-lab sleep study, then sure, we can. But yeah, it is important for people to know that you can do it in the comfort of your own home, in your own, jammies, and and the equipment isn't even that bad either, where it's just like, I mean, people are already wearing this, right? Like Apple Watches to check their sleep and Aura rings, whatnot. So it's just like that.
Yeah.
Easy.
I didn't know about the watch one. A friend of mine
Okay.
just recently did that, but I had to wear something across my chest,
Okay. Yeah.
and then I had
That's
the
one of them.
cannula and the oximeter, but I don't think I slept any worse with all of that. So, but you're
Good.
right,
Okay.
because I mean, I wear an Apple Watch to bed to track my sleep, so it
Right.
wouldn't be that different.
Yeah.
Yeah, and just a word about in-lab sleep studies when they're necessary, they're really helpful because they can pinpoint like I've had a couple in throughout my long journey with sleep apnea, and I know that there's a certain things that it'll point out which you don't get from a home test that can be really helpful, like especially titrating
Yeah.
pressure exactly perfectly, or I had a test where it was showing some periodic limb movement
Yes.
and we wouldn't have known that
Yeah.
just from a home test. So sometimes if you really need those answers, it can be so helpful. So, I'm actually kind of a big fan.
Not
Yeah,
that
I do
bad.
agree with you that I don't think we should do away with them.
Right.
They collect a lot more data. That's probably why it's a lot more uncomfortable because you have wires kind of all over you. But the home sleep studies are really more meant for really just the breathing. Whereas, like you were saying, Emma, the in-lab ones can pick up other things too, like limb movements. Sometimes people have other parasomnias, that we can pick up as well.
Yeah. So one of the things I did want to ask, and this is maybe like, I don't know, Dr. Chawla and maybe Kaitlyn too, is just about, I don't really think we have conclusive research about sleep apnea and mouth taping and whether it's good or bad or like, is there anything particular you want to speak to about that? I don't know that we've had any really big studies about that.
Yeah, I can go first. I think that you're right. There's not a lot of robust data, at least that I have seen. There have been some studies. I think it kind of started coming out, being published in like 2022, I want to say. I don't know if anyone has seen something earlier than that. The only one study that I can think of was kind of a positive for sleep apnea. It really only tested mild sleep apnea patients, and they also excluded patients who had kind of different facial structures, like someone who has like severe, like like a recessed chin. So it was really looking at a population that was, for lack of better terms, maybe like easy to treat.
Right.
And they tested them with the mouth tape only. They had mild sleep apnea, mouth tape only. They were also a BMI of under 30, I believe,
Mhm.
which also can affect sleep apnea. And those individuals, their AHI actually did improve. And, you know, it makes sense because, and I'm sure Kaitlyn can comment because, I mean, I'm sure mouth tape does help, you know, when you start breathing again out of your nose, I'm sure it can help the anatomy and the physiology of your breathing at night. But this is not to say that it's very important to just get tested for it first. For someone who has severe sleep apnea, you know, like Ronni, who was mouth breathing, that kind of serves as like how Kaitlyn said, a backup, right? Our mouth opens up because our airway is
Right.
obstructing.
Yeah.
So if you have severe sleep apnea and your mouth, you need to mouth breathe to allow for that air exchange, putting on mouth tape could be, you know, very dangerous. So all that being said, I would say no, not a lot of robust data, maybe one or two studies out there that show some positive data, but it's really only for like mild cases, and again, like easy to treat sleep apnea.
Yeah, I agree. I haven't seen a lot of, like you said, robust data on it. To me, again, it's very, sleep patients are so heterogeneous and there's so many factors that you have to look at that I don't like to make a blanket statement like, oh, if you are, you know, under a certain BMI or
Yeah.
you're only mild, like this would be great. Our anatomy is all different. So
Right.
I'm very cautious. And I don't think that I've ever said to a client, I've never been like, yeah, you should mouth tape. I've been, you know,
You've never suggested that to one of your clients.
I don't think I can't. If I did, it was maybe like a long time ago. Because obviously, like you grow as a clinician. And if I could look at myself 2 years ago, 5 years ago, I'm a different clinician because obviously your knowledge grows.
Right.
I
You hadn't, back in the day, you hadn't treated me. So you
Oh,
Yeah. So I have kind of like a formula that if somebody's really adamant about trying it, I'll say, okay, let's try it during the day first while you're upright. Let's see, can you nasally breathe consistently across the day while you're doing daytime activities? Okay, that's going well. How are you if you recline in a chair? How are you if you lay down and you're, even just watching TV, like in that position? Because as we all know, gravity is a huge factor in pushing down our anatomy and can cause that collapse.
Mhm.
And then, yeah, work your way up to trying to do like a nap with tape. That's fine. But I don't know. To me, and as a myofunctional specialist, I think it can be putting a band-aid, a literal band-aid, on a bigger problem. And that being said, I know not everyone can afford or has access to myofunctional therapy, and it can be a great tool. I just want to make sure that you can nasally breathe and that there's not something structurally in the way that's going to cause you to have less oxygen because you are now
Yeah.
taping your backup system.
Yeah, and as far as the way that, like, I've heard from certain people living with sleep apnea that they've been told by doctors, don't use mouth tape, like, it's not a good idea. And we would always like defer to whatever medical advice people have been given. But I think as somebody who tried mouth taping and has no business mouth taping, what happened with me was I was in my, like, I'm gonna just make this nose work. So I haven't been able to breathe through my nose since childhood and had all sorts of things going on. So I had a pretty serious tongue tie, which kept my tongue low and forward in my mouth, and the opposite of what Kaitlyn just described as where your tongue needs to live. So she was explaining that the tongue needs to be in the roof of your mouth, and mine never hung out there. So like, I don't know how much we want to get into it, but basically for me, talking, my daughter actually just got braces today, and I had a really good discussion with the orthodontist because the roof of my mouth is really, really narrow because it never had that tongue almost like acting as scaffolding to make it, wider. So that obviously, Kaitlyn, do you want to explain about the roof of your mouth is the floor of your nose for people?
Sure.
And a bit
Okay.
about that whole process. I'm not doing a great job of explaining what happened with my face.
No, you're doing a great job. Okay. So craniofacial development, and I want people to start thinking of basically, I want you to think of your from the neck up, that's your airway. I want you to stop thinking like this is my face, this is my teeth, this is my head. This is all part of your airway. Um, and what we don't realize, again, because no one's like, hey, by the way, your tongue's supposed to be up, that is helping drive facial growth, which is essentially airway growth. So when your tongue is resting up in your palate, it is not just your palate, it's the roof of your mouth, but also the floor of your nose. So if your tongue is not up in your palate, exerting the upward and lateral pressure, what can happen is your palate is going to start moving upwards, and it gets kind of that high or narrow V-shaped palate. And what happens then is all of a sudden your palate is now taking up your nasal airspace. So that can actually, in some cases, it can even deviate your septum because it's pushing so far up into your airway. So we want that tongue to be up there so that it's moving our face forward and driving our airway growth. Because otherwise, again, you're going to have less nasal airway space. It's going to make it harder to nasally breathe. And then you get stuck in this horrible vicious cycle where you can't nasal breathe. So then your mouth breathing. So then your tongue drops low. And the palate's just going to keep getting more narrow and higher. So you think of your tongue, and I can't take credit for coming up with this concept at all. I believe it was Linda D'Onofrio, who's also a speech language pathologist, but she said your tongue is your body's natural palate expander and your lips are the braces. And, obviously, again, there's genetic factors and environmental factors, but if we can, from a young age or from birth, ideally, even before birth in utero, have our tongue resting in the right spot and our lips closed, it's going to promote healthy airway development.
Great explanation.
Thank you.
So I do feel like I just kind of wanted to give an overview for people because I feel like this whole airway area is like there's so much to it, but I think it's good to have some sort of overview for people, of like why all this stuff is. Oh, and the other thing I wanted to ask real quick, if you wouldn't mind sharing, Kaitlyn, do you want to share a little bit about your nasal surgery? Because that can also be part of this discussion, right? If your nose is not working well, and that's the reason that you're, not able to nasal breathe well, sticking mouth tape on is not going to solve that. Do you want to maybe talk to us a little bit about the surgery that you had?
Sure. So, case in point, I did not have correct tongue resting posture, oral resting posture. Um, I have a very high, narrow palate, and I have since childhood. And that was among one of the problems. So I had a deviated septum. I also had sinus polyps, and then I also had bone spurs. So I had a whole lot of things going on. If you saw my nose prior to surgery, I had what's called a dorsal hump. So it was kind of, that midsection of my nose was kind of larger and would cause the tip to kind of drop down. I got to the point where I just was not able to fully nasal breathe. It got so bad with the polyps, and my turbinates were also very enlarged. It got to the point where it was just very hard. It was a struggle to breathe. So I ended up going and having septoplasty, rhinoplasty, turbinate reduction, and then they found the bone spurs when they were in there. And if anyone wants to go see the picture of all the things they removed from my nose, you can go on my Instagram. It's Southern Speech and Myo, and if you scroll way down, there is a whole like
Really gnarly.
It is gnarly, and my doctor probably thought I was crazy because I was like, "Can you take a picture of that and send it to me?" um, but yeah, so the first surgery, it worked well for a time. And I ended up actually having a second one because I got COVID. My turbinates hypertrophied again, so they got bigger. And I was like mouth breathing like crazy again. And I ended up having to have my septum straightened a little bit more and the turbinates reduced again. But it's made a world of difference. So now I have upper airway resistance syndrome. So I'm still I still have a sleep disorder. But now I know I can breathe through my nose. So I wear at night a mandibular advancement device, and I actually tape because I know I can breathe through my nose. I know it's clear now. I have a lot of data to proving that it's clear, and obviously my own subjective opinion, but I wouldn't have gotten to that point had I not had the surgery. So if you are concerned about having surgery, I'll say, like, I was ready to be in a lot of pain. I was ready to be bruised. I had none of that. It was uncomfortable, but I was up and like ready to go within a couple days.
So yeah, I think the difference there like is just this whole like I just hear a lot of people in comments on social media and I'm like, oh, where they just decide to do it without seeing a doctor to begin with. And I think like the difference between like with you and Ronnie's experience, you got your diagnosis, you got your treatment. So for Ronnie, that was the nasal CPAP. For you, that's the mandibular advancement device. And then you were taping your mouth, which is kind of different from people who haven't even seen a doctor in the beginning, you know? So I guess that's one of the things we want to get across to people watching. So we did have some questions.
Emma, I actually did, I started to use the tape, and then when I had my appointment, you have to go in like within the first 90 days when you
Yes.
start CPAP. I did talk to my doctor about it. But I also saw those videos where, people, the advertisements that people are just, have no sleep apnea issues, but, just, put use the tape for whatever reason they're saying they're using it. Like, I think the example before, I think, Caitlin, when you say the whole Kardashian thing, I mean, that was like, really, I'm doing it for medical reasons. You're doing it for
Yeah.
vanity. So there's a
Yeah.
big difference there.
And I think there's a big difference in how responsible people are in posting about mouth taping, right? So there's certain, like Project Sleep doesn't recommend a particular brand or any companies or anything like that. But I just know from my own experience on social media that there's certain companies where they're promising the work, like they're basically saying, use our mouth tape and you'll be sleeping so well and all of these things and promising like certain results that I'm just not sure you can really do that. And then there's other people who, like especially the ones to me that are kind of better ones that don't form a complete seal, like and don't so if you do need to get air, there's a gap or like or myotape where like there's a hole, like just so that you're not kind of suffocating, really. So there was a question. Let's see. Mm-mm-mm-mm. Yeah, just a lot of comments. Like it'll be really interesting to see if they do randomized control like type studies
Yeah.
in the future on mouth tape. It would be really interesting to see that. And Nicole asked, what are some noticeable signs of the palate push developing like high and pushing upwards like you were discussing, Caitlin?
You can see it. I mean, I'll try to show you mine. Hold on, let me see. I can show you what
I'm
a high
like, can you
angle
see
looks
my
like.
whole face? Like this is what I'm like.
Yeah. Sorry, you didn't see my spit, but do you see? So up in the top, I have kind of like a bony spur.
Yeah.
That's called a tori. But your palate should be relatively U-shaped and not high up. It should be pretty flat. So sorry, I know it's gross to show you my mouth, but
I don't really want to show everyone my teeth super close up, but
yeah.
like also like I have a crossbite, right? So that kind of shows it that the top is so much narrower.
Yeah.
The
And so you want, when you smile, another indicator that you might be narrow, when you smile, your teeth should go all the way and like fill up your mouth. You shouldn't have these dark corridors on the sides. Yeah. And you can also tell a lot of times what happens is if we're not spreading laterally, we get a longer face. I mean, you can tell I have a much longer face than it is wide. Because what happens is the mandible is rotating down and backwards instead of getting that forward facial and drive that it needs. So those are some of the signs, but like if you're worried about it in a kid or an adult, honestly, just go and look and you can tell pretty easily if it's high, it's probably noticeably high. I don't tend to find like a lot of gray area where you're like, is it high? It's usually high or it's okay.
So we have an interesting question in the chat from Caitlin, who asked, I was told by my, and of course we're not giving any medical advice of any kind. She says, I was told by my sleep doctor that I have very mild positional sleep apnea and it may develop to be more severe later in life. Can anything be done as prevention to mitigate the apnea getting worse? Do you want to think about an answer to that, Dr. Chawla?
Yeah. So, um, again, it's like very different for everyone because it also has a lot to do with anatomy, um, your physiology, like are you breathing out of your mouth, your nose? So I don't think there is anything that I can just say in general, that this could help.
Blanket
All I
forever.
can say is that as we age, it does change and it can oftentimes, yes, get worse. And then, weight gain can also make it worse. So if that is something that you start to notice, like that's something that could help if you worked on weight loss. But this is me just kind of, thinking of what, like anything that could help because really it is so different per patient.
Sorry, my dog's barking.
That's all right.
I would say, I mean, just as somebody who I probably went undiagnosed for about 10 years and then I've been on CPAP now for about 18. And I would say, I mean, this again is just talking me as an individual and it doesn't necessarily apply to Caitlin in the comments, but certainly I've seen mine progress to more severe, especially in middle age as I gained weight. So I think that's quite common for a lot of people. So that's just, my take on it. Um, oh gosh, Nicole's question, Caitlin, is what are your thoughts on palate expanders and to start at which stage? I don't know if I want to get into palate expander.
Yeah. Okay. So I'm not a dentist. I'm not an orthodontist. So technically this is not, it's not my scope of practice to say which one's better than the other. My feelings on expansion are in a lot of cases, not all cases, again, we're talking about there's a lot of heterogeneity among sleep patients. I think it can be great. I do. And I refer out, I work with a team on, expansion and I work with ENTs and ortho and everything. So I think it can be great. That is not going to fix every single sleep patient. You can expand, you can have, a wider airway, a bigger airway. That doesn't mean you're not going to get some collapse still. So I think when you do look into expansion, we need to see what other factors there are. It really needs to be a team decision of what the best way is to move forward. And as far as expansion goes, the earlier the better, because once we get to a certain age, and it's before even like the teen years, we start to kind of not, I hate to use the word solidify, but things start to stay where they're going to stay and they start living where they're going to live. If you can get in while that craniofacial development is still happening at a more rapid pace, you're going to get faster and better results. So I've had children as young as 3 go for expansion, and there are a lot of people who don't believe in doing it. They'll say, oh, that they don't need to do it that young. If it's an airway concern, then I am fully, I'm supportive of the orthodontist decision to do that, because if we can get them in young and prevent them from having all these other issues down the line, we're growing their airway. I don't even think about orthodontics anymore in terms of straight teeth. It's airway development and brain development for me. So if
Really important for people to find specialists
Yes.
orthodontist with a lot of experience in that area.
Yes. And, you know, I've gone through expansion in my preteens and then again as an adult. Just because they expand you doesn't mean they expand you for your airway, because, you know, orthodontics has changed. You need to find an airway-centric dentist or orthodontist and a team to work with. It can't just be like, hey, I'm going to go to whoever down the street and hope that they expand me enough.
Yeah, got it. Well, listen, we are at wrapping up time. Thank you all so much for being part of this discussion. I really, really appreciate each of your perspectives. It was really great. And I'm gonna just do some little, did anybody have any final like comments or anything? No?
Thank you for having us.
Yeah,
Yes,
thank you
thank
so
you.
much. I would
Yeah,
just say, don't believe everything you hear on social media.
right.
Ask a professional.
Yes. I
And I
love
guess
that.
that I would also say, you know, I think that you were saying it before, um, you know, if you suspect that there might be a problem, then check it out. Because I mean, a couple of people in my life since I was diagnosed, actually, my cousin, I don't know if he thought it was going to be genetic or something, like ran to his doctor and asked for a sleep study. And he was a little disappointed that he came back with no sleep apnea. I was like, what? I'm like,
I
you
wish
know,
more people were like that.
and then was over at our house for a couple of weeks ago for the Jewish New Year, and he was like, "Let me see your equipment." I'm like, "Dude, you want it? I'll get it." But I would really encourage people if they have the least bit
Yeah,
suspicion to just, particularly because you can do it at home when, you know, pick the night you want to do it and you know, rest better, no pun intended, either finding out that you have it or that you don't.
Right. Thank you, everyone. So I'm going to go ahead and share my screen again to do a few little closeout slides here. Can everybody see my screen a little bit?
yep.
Um, okay, so I put together a little, so again, we were mentioning at the beginning, we're going to be making a toolkit from today's discussion. Oopsie. And so we'll have we'll have more resources than this on the toolkit. But I just wanted to kind of point to, like, this was the book that I was mentioning earlier, Breath by James Nestor. And like I think we mentioned, again, he's not a doctor. It's just an interesting read that makes you start thinking about this nasal breathing versus mouth breathing thing. We didn't even really get on to Buteyko breathing and all of that stuff that Kaitlyn knows all about. There's a book called The Oxygen Advantage by Patrick McKeown, and I think that that's another really interesting read. And again, he's a breathwork instructor. He's not a doctor, but I think it's interesting if you're getting into learning about nasal breathing. So I kind of put those there. And then there's also, these are a couple of podcast episodes I recorded where I interviewed James Nestor and Patrick McKeown. There's a really good Substack by two doctors, Chris Govia and Robson Capasso. So if you haven't found that, they have a really good article they did on mouth taping where they looked at the available evidence and they just talked a little bit about it. So I think that's really interesting if anybody's interested. Um, and we usually just have these top four of the different patient organizations and patient advocacy groups here in the US. So I added to the bottom of here the Airway Revolution and the Children's Airway First Foundation. They're both kind of like in this area of like airway. So the top four are more dealing with actual sleep disorders and people with sleep apnea. But I think that they have some really good resources, especially for younger children. They're good to check out. And then again, if you're tuning in and finding this, but you don't live in an English speaking country, or indeed if you're in the UK, you do speak English, but you're not in the US. So this is a whole bunch of different organizations you can connect within your own country just to get more community. I have to mention this at every moment. So we have an awareness campaign called Sleep Let's Face It. So we're continuing to feature people who care about raising awareness around sleep apnea. So you can get involved yourself by going to Project Sleep's website, and all the information is there, or follow us on social media. It's project_sleep there. And we love it when people share, especially pictures with the sign, and you can use the hashtag to be part of the campaign. Just to mention, we have a free national sleep helpline. So this is for anyone to call. You don't have to have a diagnosis. You just might have some questions about your sleep. And our goal is to really support anyone with sleep issues and connect them with really good resources in their area. Oh, there's a Rising Voices thing in here too. So Rising Voices is a speaker training program, which I'll be encouraging Ronni to do next year. So this was kind of how I got involved with Project Sleep. And every year during the summer, we train people living with sleep disorders to become patient advocates and share their stories. So it's a really great program. You can find out more on Project Sleep's website. Thank you so much to our individual donors. So if you're watching and you've made donations to Project Sleep, we really, really appreciate your support. And also to our corporate partners, ApneaMed, Axum, Lilly, and ResMed. Thank you so much. Our work wouldn't be possible without your support. Okay, so thank you all so much for tuning in and for watching. We have a couple of toolkits coming soon. So there's the new medications one will be out soon from my conversation with Clara Yagi from Yale, which was in the summer. And we'll let you know when that's available. The biggest thing you can do is sign up for e-updates. So if you go to the Sleep Apnea Squad page on Project Sleep's website, there's an e-update sign up at the top. And that will give you all the information you need to know about everything we're doing. So I've just completed my second Coffee with Emma sleep apnea support call. So we're doing these group Zoom calls once a month. So the next one is going to be on November 9th. So again, if you're signed up for e-updates, you'll get all the information to your email. And the next Sleep Apnea Squad YouTube Live will be in December, and we're going to be talking about sleep apnea in kids. So thank you very much, everybody.